Hey everyone, and welcome back to the channel. Today, we're tackling a topic that's super important for all the expecting mamas out there. Urinary tract infections, or UTIs. That annoying, sometimes painful, burning feeling when you pee can be more than just a nuisance during pregnancy. In fact, it can become a serious concern if not handled correctly. So, let's get into why UTIs are more common when you're pregnant, and most importantly, what you can do about them. First, what exactly is a UTI? It's a bacterium infection somewhere in your urinary system, which includes your bladder, ureters, and kidneys. The most common culprit is a bacterium you've probably heard of, E. coli. Normally, your body is great at flushing these things out, but pregnancy changes the game. Your growing uterus starts putting pressure on your bladder. This can make it difficult to empty your bladder completely, leaving a little bit of urine behind. And that leftover urine is the perfect place for bacteria to hang out and multiply. On top of that, pregnancy hormones, like progesterone, cause the muscles of your ureter tubes connecting your kidneys to your bladder to relax. This slows down the flow of urine, giving any sneaky bacteria even more time to set up camp and cause an infection. So, it's not just you. There are real physiological reasons why you're more susceptible to UTIs during these 9 months. So how do you know if you have one? The signs can be pretty distinct. You might feel a strong, persistent urge to urinate, even if you just went. Then, when you do go, there's often a burning or stinging sensation. You might also find yourself running to the bathroom constantly, only to pass very small amounts of urine each time. Some women experience a feeling of pressure in their lower abdomen or pelvic area. And a couple of other telltale signs are cloudy, murky-looking urine or urine that has a particularly strong, unpleasant smell. If you're noticing any of these symptoms, it's definitely time to give your doctor a call. Now, let's talk about why it's so critical to get a UTI treated during pregnancy. An untreated bladder infection can travel upwards to your kidneys. This is a much more serious condition called pyelonephritis. The symptoms of a kidney infection are more intense. Think high fever, shaking chills, nausea, and pain in your back or side, usually just under your ribs. A kidney infection during pregnancy isn't just dangerous for you. It can increase the risk of serious complications, including preterm labor and delivering a low birth weight baby. This is why we don't just wait and see with UTIs in pregnancy. Getting prompt treatment is key to keeping both you and your baby safe and healthy. The good news is that treating a UTI is usually straightforward. Your doctor will likely ask for a urine sample to confirm the infection and identify the specific bacteria causing it. Then, they'll prescribe a course of antibiotics that are safe to take during pregnancy. It's so important to follow your doctor's instructions precisely. Let's go over some of the common antibiotics you might be prescribed, so you're familiar with the names. One common choice is it's very effective, but is typically avoided in the last few weeks of pregnancy, right before your due date. Another one is cephalexin, which is a great, safe option for many pregnant women. Amoxicillin might also be used, but its effectiveness depends on whether the specific bacteria causing your infection are sensitive to it. Your urine culture will help determine this. Finally, there's an option called fosfomycin, which is sometimes prescribed as a convenient single-dose treatment. Now, here is the most important part about treatment. You absolutely must finish the entire course of antibiotics your doctor prescribes. Even if you start feeling better after just a day or two and you probably will, the infection might not be completely gone. Stopping the medication early can allow the leftover, stronger bacteria to multiply again, leading to a recurring infection that's even harder to treat. This can also contribute to the bigger public health problem of antibiotic resistance. So please, take every single pill, exactly as prescribed. Of course, the best way to deal with a UTI is to avoid getting one in the first place. Prevention is your best friend, and thankfully, there are several simple, effective habits you can adopt. Number 1, and you've heard this a million times for good reason, drink plenty of water. Staying hydrated helps dilute your urine and ensures you'll urinate more frequently, which flushes bacteria from your urinary tract before an infection can begin. Aim for at least 8 to 10 glasses of water a day. Hygiene habits also play a huge role. After using the toilet, always wipe from front to back. This simple action helps prevent bacteria from the anal region from being spread to the urethra. Also, Try to urinate both before and after sexual intercourse. This helps flush out any bacteria that might have been introduced into the urethra. What you wear matters, too. Opt for underwear made from breathable materials like cotton. Synthetic fabrics can trap moisture and heat, creating a warm, damp environment that bacteria just love. Loose-fitting clothing is also a better choice than tight pants or leggings. And be mindful of the products you use. Avoid douches, feminine powders, and harsh, scented soaps in the genital area. These can irritate the urethra and disrupt the natural balance of good bacteria, making you more vulnerable to infection. Some experts also suggest that limiting bubble baths and opting for showers can be helpful. I want to add a critical point about when to seek immediate medical attention. If you have UTI symptoms and you suddenly develop a fever, chills, severe back pain, or start vomiting, don't wait to call your doctor. Go straight to the emergency room. These are hallmark signs that the infection may have spread to your kidneys, and a kidney infection requires prompt, aggressive treatment, often with 4 antibiotics and hospital monitoring to protect you and your baby. So, to wrap things up, remember that while UTIs are common during pregnancy, they are not something to ignore. A simple bladder infection is easily treated, but neglecting it can lead to very serious consequences. Pay attention to your body, know the symptoms, and talk to your doctor right away if you suspect something is wrong. By staying hydrated, practicing good hygiene, and getting prompt treatment if needed, you can navigate this common pregnancy hiccup safely. Thanks so much for watching today. I hope you found this information helpful and empowering. If you did, please give this video a thumbs up and consider subscribing for more content on pregnancy and health. Drop any questions you have in the comments below. Stay healthy, and we'll see you in the next video.